Sure. So the Ontario legislature was recalled yesterday, again with just a skeleton crew, and they had unanimous consent and support of all the parties at the legislature to pass Bill 189 with just 80 minutes to date. And that extended, the biggest thing it did was extend the emergency order to May 12th. And also, there were some technical changes in education, both in primary and secondary and colleges and universities that were part of that bill as well. But the big thing is the emergency order is extended to May 12th. That doesn't mean that all the restrictions that are in place right now will stay. It really depends on how we make out with health outcomes. If we start doing better, then we may see some reduction of the orders, loosening of the orders. But basically, they're following it day by day. We had 494 new cases today, and it's been under 400, but fairly steady the last few days. We need to see some improvement in the health outcomes, and then hopefully, eventually, we'll see some getting back to normal.
So, Norm, one of the other changes that was announced was the updates to how long-term care homes are being dealt with in Ontario. Can you tell me a bit about that plan?
Yeah, I mean, it's been heartbreaking, really. The most vulnerable population and the hardest hit, not just in the province, but around the world. I was, certainly my heart goes out to all the families that are affected. I was speaking last week to Laurie Scott, who's the MPP for Haliburton, and that has the Bob Cajun long-term care home that's really been the hardest hit. And it's terrible because, it's small towns, lots of people in them and quite a vulnerable population. So there were, from the beginning, there's been strict restrictions on who can go into long-term care homes and protocols that have been put in place. But now there's even stricter and a bunch of other measures that were announced by the Premier and Long-Term Care Minister Dr. Mary Fullerton, so that now they're going to be using hospital staff and home care nurses and doctors to help out in long-term care homes. They're going to be, one of the key things is they're going to be limiting, so long-term care workers will only work in one long-term care home, so they aren't going from home to home and moving the virus with them. And there's specialist infection control people that are going to be put in place. There's also going to be, staffing is a big challenge, so they're going to be using the job matching portal to both federal and provincial to bring retired doctors and nurses in to help out. And they're ramping up testing dramatically. I know the Premier's been a little frustrated that it's not been as high as he would like, but I think the testing numbers today were 6,000. It's not as high as he would like to see, but certainly the vulnerable populations like long-term care is one of the prime targets to try to test everyone asymptomatic and symptomatic in those long-term care homes.
So Norm, I know there's discussions about what happens at the end of this, and part of what you're doing is preparing for getting the economy back in order. Tell me a bit about that.
Sure, and I've been, I've hardly left my home for the past month, other than to go to take the garbage out and a few other essential things. But I've been doing a lot of conference calls and Zoom calls with many different sectors. With the retail sector, of course, all the tourism-related businesses, accommodation, restaurants, campgrounds, children's camps, and golf courses, and a lot talking about how do we come out of this, and whether we can have a phased approach, which I think in many cases will make sense as we come out. The province has also created a committee headed by Finance Minister Rod Phillips, and it has Vic Fideli, the Economic Development Minister, on it, and people that aren't ministers that will be consulting with all the various sectors, so that as we start to win the health battle, we'll be able to get industries ramping up as quickly as possible. I know I was on the phone yesterday with 17 marinas from around Parry, Muskoka, and they would like to be able to, they're concerned that when we get back to normal, all of a sudden everyone's going to want their boat, and they would like to have a phase where they can start to do some of the rigging and preparation ahead of time, because they know they just won't be able to handle all at one time. So that's the sort of thing that I think we will need to do. Other businesses that took time with the pandemic to start renovations and then were forced to shut them down when the essential businesses were changed. So I think we're going to need to allow some of those businesses to start early to finish those renovations where they can do it in a safe way. So those businesses will be able to open, and other businesses that, like landscaping, where you may not, where you'll be able to maintain social distancing, et cetera. You have to look at all those, how we can phase them in and get them back up and operating when we start winning the health battle.